Just explain exactly what the concerns are. Of course, we understand, and the government, the medical advisors, the scientific advisors have all pointed out we will see infections rising after July the 19th. But it's the effect that it might have on younger people that is raising some concern.
When we're talking about younger people here, we're talking about young adults, so people essentially over the age of 20. And what we've been seeing in our data, and we're going to be talking more about this in the next couple of days, is that even younger people in the ages of 20 to 50 are suffering kidney injuries and liver injuries during the acute phase of COVID. And some of these will lead to lifelong problems. Many of these will get better on their own. But in themselves, these show that COVID isn't just a flu virus, it's actually causing damage to other parts of the body that are actually quite significant. What surprised us now is that these injuries aren't just associated with the frail and elderly people, which death from COVID absolutely is. And we're instead seeing these in much younger age groups. Essentially, the people that have survived COVID are getting damaged.
Do we have any idea as to why that might be the case? Why there would be this effect on a group of people that we all look at rather enviously as being young, attractive, fit, and healthier than you or I?
Except these are the ones that have come into hospital, so they've had it bad. They have been the unlucky ones that have had it severely. It does go to show that you can be unlucky, and just because you're young doesn't mean that you're invincible. It emphasizes the need for vaccination, because the other surprising feature of this research is that severity at admission to the hospital is one of the stronger predictions of your likelihood of having a complication. That means that your pathway to having that complication was set in a tablet of stone before you came to hospital, which means it's less likely that what we do in hospital will prevent that injury. Not to say that we're useless. We have got good drugs and good treatments. It's just that if you know that the disease severity at the front door is predicting the outcome, you've got to do something to people before they get to hospital. And the best thing to do is to prevent the disease in the first place. And that means vaccination. So wrapping this all up, it means that vaccination is still going to be the way out of this, even for the younger people under the age of 50.
I may well be, I don't want to be putting words into your mouth, but I'm taking it from what you're saying there, that in terms of those that we're seeing in hospitals suffering kidney disease, suffering that scarring on the lungs, in the main, those are people who have not been vaccinated either once or twice.
You're right, particularly now that we're going into wave 3, where I'm trying to get this off the top of my head, but I think it's about 88% of people in hospital either haven't been vaccinated or have been vaccinated so recently that the vaccine hasn't had a chance to work. So, yeah, it's a bit of a no-brainer now, where the evidence is overwhelming that vaccination is highly protective.
Are there any concerns, and Professor Semple, you'll know the data on this, but are there any concerns for those under that age group that we've been discussing, the young people of 20 years and over? Are we seeing anything similar in terms of kidney disease, lung scarring, other problems amongst people who are under the age of 20?
So that kind of analysis is ongoing. I am aware of a research group that is going to publish shortly, or has just published today, it's going to be the next day or so, about a very small number of children having some problems with their brains. On the whole, children are not severely affected by COVID. Death rates in children from COVID running at around about 1 in a million to 2 in a million, probably closer to 1 in a million. So very, very far fewer children affected, but they do get this multi-system inflammatory disorder. Now, again, it's small numbers, but it does show that the virus can get into other parts of the body than just the lungs.
Professor Calum Semple, as always, thanks very much for being with us.